During the 2010s, local councils across the UK, but particularly in England, faced big cuts in funding. Net spending on services by English councils fell by 18% in real terms between 2009-10 and 2019-20. After accounting for population growth, the fall in spending per person was even larger, nearly a quarter. The pandemic has pushed up council spending and reduced their income from things like local leisure centres and high street parking. The UK government has provided substantial financial support to councils to help them weather the crisis. Overall, the UK government provided support totalling £10.4 billion in 2020-21. Across the sector as a whole, this slightly exceeded the financial pressures councils reported. Additional funding is also being provided to councils in 2021-22. As of September, the government had announced around £3.8 billion worth of support for the whole year, but councils forecast pressures of £3.2 billion in the first half of the year alone. This leaves very little for the second half, suggesting the Chancellor may need to step in to provide more funding. Looking to the future, pressures from COVID are likely to persist, but to decline over time. More importantly, in the medium term, underlying increases in the demand for and the cost of council-provided services will add billions to the amount councils need to spend just in order to maintain provision. Under the government's current spending plans, council tax bills could need to rise by an average of 3.6% each year or more for the next 3 years if councils are to provide the range and quality of services in 2024-25 as they provided before the pandemic. This would push up the average annual council tax bill by at least £160, or £77 after accounting for inflation. But in the near term, even council tax rises of 3.6% wouldn't be enough. Councils would still be facing a funding gap of around £3 billion in 2022-23. Unless the Chancellor stumps up more cash at the upcoming spending review, councils are likely to have to make cuts to some services when they set their budgets for next year. The government also recently announced major reforms to adult social care services, including a new lifetime cap on care costs and more generous means tests.
From next April, we will create a new UK-wide 1.25% health and social care levy on earned income hypothecated in law to health and social care.
It will provide £5.4 billion over the next 3 years to begin the rollout of these reforms, as well as to make other improvements to services. Given the scale of what the government wants to achieve, even this large funding increase is unlikely to be sufficient to meet its ambitions over the next 3 years. By the second half of the 2020s, the reforms could cost up to £5 billion a year. Raising the pay of care workers or relaxing needs assessments to enable more people to access support would require billions more. Even with the new health and social care levy, social care is likely to remain a financial headache for councils and chancellors for years to come. So, in setting their budgets next year, many councils across England may face the unenviable choice between large council tax increases for their residents or making cuts to at least some services. The choices the Chancellor makes at the upcoming spending review will determine just how difficult these choices will be. The IFS Green Budget is produced in partnership with Citi and is funded by the Nuffield Foundation. To find out more about local government funding and the other challenges facing the Chancellor, visit www.ifs.org.uk/green budget.